Hi, I'm Dr. Greg Wilkins. I'd like to welcome you here to Advent Health Manchester. We're excited to be talking to you about colorectal cancer. I'm a general surgeon and also director of wound care here at Advent Health Manchester, and we are just wanting to let the community know a little bit about some life-saving interventions that we have to offer you here. One of the most common questions I get is, when should I get my colonoscopy? Well, the recommendation says that the first colonoscopy should be at age 45 years. Now, I know a lot of you are thinking, that's younger than I thought. And that's true. And that's been changed because we have patients getting colon cancer at younger ages. And remember, even at 45, it's possible that you could have colon cancer already. So this is just for screening. If you have symptoms such as seeing blood in your stool, such as having unexplained abdominal pain, unexplained weight loss, perhaps your doctor said you had anemia, and there are other symptoms you might want to discuss with your change in bowel habits that would participate with the colonoscopy program at a younger age. Colon cancer is a serious issue. It's the #3 cancer killer in the United States, and it's about the 3rd most common cancer as well. And colon cancer is unique in that I always tell my patients it's essentially preventable. If we get you in before you have colon cancer and start you on a colonoscopy screening program, you should not really ever have to deal with colon cancer in your life. And colon cancer is quite common. We see it more in this area than across the country, but even across the country, it's approximately 1 in 24 people will get colon cancer. The test can be done while you're completely asleep, and it can reap the benefits of if you've already started to get lesions such as polyps, which will turn into colon cancer, we can remove those. It's life-saving, and we highly recommend it. So you've made your mind up that you would like to go ahead and get a colonoscopy scheduled. All you need to do is see your primary care physician, nurse practitioner, or PA. They can easily give you a referral to myself or one of the other physicians who offers this service in the area. And at that time, you'll come in, get a routine history, physical, we'll order some labs and blood work as well as x-ray if needed, and then schedule you around your schedule. It's an outpatient procedure. You'll come in, get an IV started, and go to sleep. I always tell my patients, we don't expose you, we turn the lights out, we're looking at a video lens and a video camera. You're completely covered and in the dark and on your side. At that time, we run the scope up. We do take biopsies and or remove polyps, which is the whole reason to have it, because if you have those, that's what prevents you from getting colon cancer. If you don't have those, great. You don't need one for 10 years. Patients who have had colonoscopies are the easiest patients to talk to about having another colonoscopy. They're over the initial fear of having it and realize that it's really just a benefit to them, and it's not really that big of a deal. Most of us are scared about anything that we have to have done, and that's normal. I am too. So don't worry about that. We empathize with that, we'll work with you through that, and we'll try to take care of you like that as if you're family here at Advent Health. Besides the ability to do colonoscopies, we can also take care of hemorrhoids at the same time. We can do it in a painless manner while you're asleep. It's wonderful new technology. I've been using it for several years now, and I can't tell you how excited I am to be introducing it here at Advent Health. If you've had the procedure done, you know how amazing it was to come in, be asleep, wake up, and not only did you get a colonoscopy that cleared you from worrying about cancer for 10 years, but you took care of that irritation from the hemorrhoids, that intermittent bleeding that you were having that was scaring you. You're asleep, the brain doesn't even record that this happens to you, so it ends up being a great experience because you get it taken care of and you have a better life. Remember that when you see your physician about that, you can ask to see whether they have that available for you and take care of 2 things at the same time and just get added benefit out of getting your colon cancer screening completed. Here at Advent Health, not only do we have the ability to offer you screening, but I'm excited to say that we have more comprehensive care than that. We're affiliated with Marquis Cancer Center, and Dr. Banja, our oncologist, is able to provide oncological services, as well as our general surgery department is able to provide surgical services. So should you find yourself in a position that you need surgery, that you may have cancer or a polyp that's too large to remove at a colonoscopic time, that's all available. And should you, after needing that, need further oncologic services with perhaps chemotherapy, then that's available too through our oncology department. This is a program that requires a lot of extra attention to detail, and that detail is about you and providing you the best services and your family. And that's what we want to do here. We don't want you to have to feel like you have to be separated, that you have to drive a long distance, that you can't visit your family member while they're recuperating. All these things are important to me and my family, and I think they're important to you.